Right. Welcome, everyone. Again, thanks for being here and introducing yourself in the chat box. Hi, Emily and Jen and Lulu as well. So great. What a great crowd we have today. So glad you're here. All right, so let's get started. I'm going to start with sharing our agenda, which is in this document. It's a Google Doc. I know not everyone can access Google Docs, but we will share it for those of you who can. This is something that is intended to be an interactive document, so you are welcome to add anything to this. Um, and also know that the recording it will be found on our YouTube page if you have to leave early or if you want to share it with anyone who wasn't able to attend. So the plan for today is to first run through the agenda as we are and do introductions as we are. Thank you for this. And I'll give a brief update. I'll kind of run through what's in this document, and then we'll have the bulk of the rest of the meeting to give you all an opportunity to introduce yourself and share again where you are calling in from and what is going on in your world. So, what questions do you have? What do you want to hear more about? What work are you doing that you think we should all know about? And I know that there's a lot of it out there. So, I'm really excited to hear from all of you on what you're doing and maybe what challenges you're having that we could all help you with too. Okay, and then if we have some time, we might wrap up. But for now, let's move along with this document and share. As many of you know, we have quite a few committees, and that committee structure might change a bit as we roll out our new strategic plan, which is what we've been really focusing on the last 8 months, I think. We are very close to finalizing it and having the board vote on that tomorrow. Either vote to approve it and finalize it or make some more tweaks. We'll be sharing that out more throughout National Breastfeeding Month and sharing more during our conference in September. So really excited about that. Based on that strategic plan, we will decide what committees are needed in order to keep that work moving along. Okay. Just double checking. Here we go. I have to monitor the waiting room now as well. So we have a lot of great work that's being done. I would say that the major focuses have been on strategic planning, like I said, and also our conference in the fall. We are also continuing to schedule educational webinars, so I'll share more about that. And we're always open to topics for next year. So if you know of, if there are any topics you're looking to learn more about or any presenters you've heard that you feel like the whole coalition would really benefit from hearing, please send those our way. You can either send them right to me at director@mainebreastfeeds.org or info@mainebreastfeeds.org or education@mainebreastfeeds.org. Any of those would get to me and get to us as we do some planning around all of that. So I'm going to continue to move along. There are ways to support us. Not only would we love your volunteer time to participate in some of those activities, but also we are happy to receive any sort of financial donations. And you can donate directly through our website, or you can start your own Facebook fundraiser, or you can again, donate your time. We want to thank the annual partners who we have at the advocate level who are making it possible for us to do the work that we do. If you're looking for continuing education, if you have any suggestions for continuing education, again, go ahead and add to this document. You should all have, oh, there we go. I want to double check that. You should have abilities to edit that document now and add any educational webinars. Our next, or continuing education resources, our next webinar is August 7th coming up, and it is going to be by Dr. Denise Horge. She is going to speak about social determinants of health and how they affect breastfeeding. This is a really, really important topic and something that applies to every single one of you and every one of us who's part of this coalition. So I highly recommend you sign up for that. As we're continuing to request donations with registration, it can be $1, it can be $100, whatever you're able to do. Makes it possible for us to cover the cost of the speakers and the time it takes to make these webinars happen. So please sign up for that. I will put that in the chat box right now so that you can link to that easier. And as I mentioned, our fall conference coming up, now is a great time to register. We are going to have some really fantastic topics. We'll have opportunities for networking and connecting with people. I mean, it can be so powerful to be in a space like this, but also especially in person together. And that will be in Augusta at the Civic Center. Our early bird rate will go until August 5th. We also have a group rate. So if you have coworkers or anyone in this call who you're like, oh, let me see if that person would want to register with me, you're able to register a group of 5 or more for that same early bird rate. So that website to sign up for the conference is coming into the chat now as well. Okay, so the topics that we have, well, we'll have continuing education. We've applied for SERPs for IBCLCs and contact hours from the Nurses Association. And many of these continuing education credits are often available for other purposes as well. If you are a registered dietitian or if you have another credential that requires continuing education, from what I understand, those could also be used toward that. Okay, the topics we have we have Jan Tedder speaking about baby behavior and how important it is to understand and help build parent confidence in their breastfeeding success when they understand their baby's behavior. Huge topic. If you feel like that's something that you're already familiar with, that's not new information for you, will be really good reinforcement for sure. And some tips on how to have that conversation. And Jan is a really fantastic speaker. Megan Moran will be talking about the physical therapist role in breastfeeding. And Laura, who is a family nurse practitioner, is going to talk about normal growth patterns and specifically how to know when to supplement, what's the best way to supplement if necessary, and what is also just a normal growth pattern. And then Lisa Shear, if you haven't already encountered Lisa, she's a fantastic resource when it comes to flange fitting. She's also just a fantastic IBCLC, but she will give a great overview of what to know about how to make sure people are using the right size flanges. And as I mentioned, we have other topics and other workshop times throughout the day where folks can network and talk about advocacy a bit in this time of needed advocacy. And we will have exhibitors at the conference as well. We're excited about that. Definitely appreciate the support from all of these wonderful folks. If you don't already know about the LGBTQ plus resource, this is always a good reminder, a chance to remember that that is out there. Zip Milk as well. I hope that since everyone here, from what I can tell, is working with a family or is working with families, you in supporting their breastfeeding goals, you should be listed on Zip Milk and you can submit your listing. I'll put that in the chat box as well. There are different categories where you can submit your listing. So I highly recommend you do that so we can have Zip Milk populated as much as possible. And then we have some other resources that are always good to know about. Our workplace resources are always available and super helpful. We also have our recognition program that we want to remember. We can maybe talk about that later as well, but we've so far only recognized the town of Brunswick. It's the only one that has applied for recognition for supporting workplaces or supporting their lactating employees in their workplaces. And we want to recognize more. We know that there are more places out there. It is required that they have a policy in place. Our toolkit for them includes a sample policy. So it should be easy. We should be providing enough resources for them to make it possible, but they might need someone like you to help them with that, or at least connect them to us to then help them more. So I wanted to make sure we mentioned that. Also, our employee toolkit is available in 4 other languages. The postcards that are used that you can hand out to families are also available in 4 languages. So we want to make sure that you know about that. And I will put that link in the chat too. And then I wanted to announce, if you haven't already seen, that we worked really hard on a bill this session to require Medicaid reimbursement for private practice lactation consultant services. And it passed out of the Health and Human Services Committee after we had lots of public testimony in person and written. I think nearly 50 pieces of testimony were submitted. And then it was voted on in the House and voted on in the Senate to pass, and the governor signed it. And a really important step before that is that the Appropriations Committee funded it, which meant because there will be a cost associated with setting up the reimbursement side of things on Medicaid. Excuse me, yes. And Mitchell, I see you're here. Glad to see you're here. Mitchell really helped lead this effort and provide a lot of information to the legislators who sponsored this bill, and there's just been so much uh, there's been so much learning along the way, and we're really, really grateful. We weren't sure it was going to get everything it needed in order for for the governor to sign it, and we're really excited about it. Now we just have to hope that there will be enough money in Medicaid to cover this, and we'll see how this continues to go. There might be some rulemaking that we are hopefully a part of as well. So yes, thank you to Mitchell for helping to spearhead this. LD 1523 also passed. I think I see Sarah here, and maybe Sarah, you can share more about this as well, and what that bill passing means, and and a bit about the TEMA grant. I saw you join, and I hopefully you're still here. Okay, there you are.
Hey, Kara, do you want me to share now or later during the sharing
Like
time?
in 1 minute. You'll go
Okay.
first. Okay. I just want to be able to stop sharing my screen. Paid leave is, we're so close to paid leave being available, and that'll be in the spring, but that's moving along nicely. Um, Another thing that we want to let you know about, many of you should know about the pregnancy risk assessment monitoring system and that program, the survey that people are getting. There are some concerns about funding for that program continuing, and there is some sample language that we've sent out in an email and is here in this document that I'll put in the chat box again for you all to have. If you want to contact your federal or your um, Maine senator and representatives. And I think that is about it. Other than if you're in the Portland area, save the date for August 5th from 5 to 9 p.m. That is when the next flatbread benefit night is, and that will be benefiting the Maine State Breastfeeding Coalition. We're always really grateful for that opportunity. And um, that's during World Breastfeeding Week. So we're really excited about the timing, and it should also be a busy time for flatbread. So we're excited to be part of that. We've got our workplace resources. If you at any point have any job opportunities in your workplace that you want us to share out, you can either add that to this document during the meeting or send it to me ahead of time, and I'm happy to add it here or add it to our newsletters. And that is it from me. Okay, so Sarah has an update. Mitchell, you have something you're going to want to share. That's awesome. Everyone else, I see we have 28 of us here, which is awesome. If you can be prepared to raise your hand or just type in the chat box that you have something to share, then I'll know that you can be up next. Sarah, go for it.
Hey, sorry I interrupted. So I'm Sarah Toohey. I'm the co-director of the Maine Doula Coalition, and yeah, LD 1523, which was the doula reimbursement bill, passed. It's now law. So that bill was really created just to mirror what's happening in the TEMA, or Transforming Maternal Health Care grant that the state got in January. So it requires the state to cover doulas under Maine Care by early 2028. And it also mandates that there is a doula support council that's created to help to inform initial implementation and reimbursement rate making, but also that that support council will exist as long as reimbursement exists, just to ensure that 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 program to reimburse doulas is managed well, and that there are doulas at the table for any changes that happen in the future. So all of that is really kind of side by side with what's happening with TEMA. So there's nothing in that bill that's not already happening with the TEMA grant, but the bill really ensures that even if something happens with the TEMA grant or after the grant is done in 10 years, that doula reimbursement and that support council will continue forward.
Awesome. That's great news and great work. I know that the Maine Doula Coalition worked closely with the Maine Women's Lobby on that as well. And it's just always so nice to see that teamwork happening and to see that Sarah, the Maine Doula Coalition, was also nominated for an award from the Maine Women's Lobby. Can you say more about that? Or you were given an award?
Yeah, we are receiving a collaborative partner award from the Maine Women's Lobby, who really ran that bill. The Doula Coalition provide a lot of expert opinion and advice and gathered testimony. So if any of you will be there this evening, Kara, I think you'll be there. The Women's Lobby has their annual end of session event in Scarborough at Broadturn Farm. So I'll be there, and Meg and Kate, and I think maybe Kara will be there. Maybe I'll see some of you there tonight as well for that event.
Yeah, I'm excited. Looking forward to it. It's really moving to see so many people who are, excuse me, working on advocacy for not just women, but maternal infant health in general, and not just women, but folks of all genders, really. Um, so, Mitchell, would you like to go next? And if
Yes, I definitely can. I can turn my camera on if you give me like 3 more minutes. If somebody else has something to say, they're more than welcome. So, I was in between. Oh, I was in between my client's house and my house at 12 because there was a thing that happened. So I'm literally like 2 minutes from home. So if somebody else has to talk.
well, you're a little bit choppy as well, so it might be best for us to come back to you anyway, Mitchell, if that's okay. Okay, we'll plan on coming back to you. And this is a time in the meeting when it is nice to have as many cameras on as possible, so it feels like a true networking coalition meeting. I understand that some folks might be eating or you might be in between places and all that, so I understand that, but it is really nice to see faces, and thank you for turning your cameras on if you're able to do that. Who else has something to share or ask? And I will call on people if I'm not seeing hands go up or folks sharing.
I'll go ahead and share, Kara.
Great, thanks.
Just to reassure people that the WIC program is still funded, refer people to the WIC program. If we're going to have a new website with the state Maine CDC on Monday, and all the agencies are listed there. There's a portal where people can self-refer, and I get those emails and then I refer them to the appropriate agency if they're wondering if they're eligible for the WIC program. But all the agencies are also listed on the website and you can contact them directly. But please keep referring people, and we will keep accepting participants. The WIC Farmers Market program started, which is a separate pot of funding that we have, and every participant or who was ever an active participant as of January 1st got $10, which is a decrease in funding, that part, but people do have the option now to go to the farmers market and spend their $10 at the farmers market. So thank you. And I'm Robbie with the State WIC program.
Awesome. Thanks, Robbie. Does anyone have any questions for Robbie about WIC in general? I see Lynn has a question. Does the Rockland WIC still loan out Symphony breast pumps?
All the WIC sites do. I would just say to find out, the Belfast site is, I know, open with staffing in Mid-Coast. It has been a challenge. So I would call them first. If you're having trouble, contact me. You can always email our Maine State WIC email, but let me put my email in the chat as well.
you.
We do want
Brianna,
to make sure people are served as soon as
yeah,
possible.
excellent. Thank you, Robbie. I'm glad you're here today to represent too. I know we have some other folks, I believe, on here from WIC too. Brienne, that's awesome about starting a support group in Belfast in partnership with the Waldo YMCA and Maine Families. That's so great. Looking to get the word out to the Mid-Coast community. So if you're not already listed on our support group directory, that is the
We're
link for
not.
you.
We're not because we're really still in the planning stages. I have a survey that I'm trying to get out into the community right now. Um, Really hard to get people to respond to surveys. So if you serve that community, I'll put my email in the chat. I'd love it if you could reach out to me and I'll forward you the flyer. I really need like warm handoffs to people, like in order to get them to participate. And it's a really short survey, just asking like what kind of topics folks are into, what kind of days of the weeks and times would be best for them. We really want to target it to the needs of people. It's going to not be specific to breastfeeding, but I'm a CLC, so are the Maine Family Visitors. So we'll have offering for counseling for breastfeeding, chest feeding folks as well. So if you're in that area and you're interested in helping or participating in any way, please reach out to me. Thanks.
Awesome. Thanks, Brianne. And Lynn is asking if you've connected with Kristen Jacobs at the midwife's office in Waldo. Good recommendation.
Thanks, Lynn.
Yeah. All right. Who's next? I did see Rachel Criswell join. Are you available, Rachel? I know you have something you wanted to share.
Hi. Yes, I am. How are you doing? It's so nice to see you all. Um, are we doing like sharing our recent news?
Yeah, so sharing anything you want to share, introduce yourself and where you're coming from, and yeah.
Excellent. I'm so sorry I was late. I was just finishing up with patients. My name is Rachel Criswell. I'm a family medicine physician and environmental health researcher in Skowhegan, Maine. I was on the Maine State Breastfeeding Coalition board for a little while, and now am an enthusiastic member on the sidelines. I wanted to check in with everyone today because I'm starting a new research project as of July 1st on PFAS in human milk. My area of research has been PFAS here in Maine and then effects on mental health and physical health. And one of the things that we've found among a number of different cohorts is that PFAS appears to be associated with a shorter lactation duration. And so we've designed a study to try to get at the why of that, with the thoughts that PFAS may be contributing to changes in the composition or quantity of milk. So I'm working with Maine Health and Tufts University to collect 30 samples of human milk here in Maine. I'm hoping to do it around 1 to 2 months. And I'll be analyzing that for PFAS levels and then also for proteins that are markers of nutrition and markers of quantity. I'm recruiting at Redington Fairview and where I work and deliver, and I'm an IBCLC, and then I'm also recruiting at Maine General. And I'm hoping to get people from a broad range of experiences, not necessarily high PFAS exposure, but people who are just interested in supporting research. So I'm going to be sharing my recruitment flyer with Kara that has all our information on it. And I'm happy to take any questions and appreciate any referrals that you all might have.
Thanks, Rachel.
Thank you so much. I'll put my email in the chat here.
Perfect. Yeah, that might be a topic. I'm just curious if anyone is especially interested in the topic of PFAS and in general, but also related to breastfeeding. I think it's going to be really interesting to see the results of your study. But if you have a special interest, it's great to share that here too. All right. Thanks, Rachel, for sharing that and your contact info. Mitchell, I see you're back. Go for it. You're on mute. Okay. if now is a good
Yes,
time.
I'm trying to get my 3-year-old out of my space. He saw that I had gotten home. So a couple of things. I'm doing an event here in Bangor on August 2nd. Really excited. It's partially to celebrate World Breastfeeding Month, week, everything, but also to um provide resources to families. I've recently gotten a lot of requests for like, where do I take my used baby items? Where do I take this? So one of the things that I decided to do with this event is called a swap and shop. So they bring any items that are of good condition, are, able to be utilized by another family, and the other family can come take whatever they need. Anything left over is going to Wellsprings Infinity House. They are an amazing resource here in the Bangor community. They're a rehab center for pregnant or moms of children under 5, that they can actually the kids can stay with them at the center. Um, and they're just a really good resource that I've been connected with. So that's where everything's going to go. If it's something that they can't take due to whatever, Foster Families of Maine is taking the rest of anything. So really excited to just be connecting the community with that and putting that together. It's August 2nd at Jeff's Catering from 9 a.m. to 12 p.m. And I've got a farm coming. So there are going to be petting zoo. There's going to be car seat checks. Maine State Breastfeeding has a table. There's a couple of midwives that have tables and a doctor's office that also gathered a table. And then if you have resources but don't have a table representing your business, I'd love to have the resources sent to me, because I am going to have a little resource table for families, even if they can't have access to somebody specifically to talk to. So if you want my address for those resources, just send me an email and I'll put my email into the chat. Regarding Maine paid family leave, my husband recently had a surgery and we ran into an incident with his short-term disability company getting confused about the Paid Family Medical Leave Act in Maine covering the services. And we went round and round and round with trying to figure out who we needed to talk to confirm we weren't receiving those services yet. So there is the Maine State Bureau of Insurance. And that was finally who gave us like a letter stating that no, paid family medical leave is not active yet. Which, being part of, this service and everything, I already knew, but it was just hard getting that like concrete evidence. So if anybody else is having a family that's having difficulty getting access to their short-term disability, that's the process of who to go to, is the Maine State Bureau of Insurance.
That's really great to know, Mitchell. I'm sorry you had to deal with that. Glad you found the right contact person. And yeah, that's interesting if that's is misinformation in the insurance world, but it has not started yet. Thanks, Mitchell. All right. And yeah, if you can type in the chat box too, Mitchell, information about the event you're hosting, that might be helpful to have that in writing. Cool. Marianne, I see you, and I'm wondering how things are going in Portland. Do you have an update?
Yes, well, some things have changed for us, but myself, our program was downsized greatly by 4 nurses, 3 nurses. So myself and my coworker, Larissa Stout, we're both CLCs, RNs, and have years of experience in maternal child health work, working with families. We still remain employed by the City of Portland Public Health Department, and so we're really fortunate. I've been there for like 27 years. So, so we're right now we've been integrated into some of the other services that public health offers, now that we don't have the funding to continue with home visits through Cradle Me. That service is still available, as the public health nurses on here know, for families, but just by other agencies at this point. We were subcontracted and there was a diminished amount of money. So anyways, so the work we're doing is with STI testing, lead testing. We have a lead care 2 machine, and some immunizations, and whatnot that public health also offers, some ophthalmology situations. However, we've been asked to continue to look at ways to continue to support families in Portland area. We're part of the Health and Human Services Department, which runs the shelters, and they have asked us to find ways to fill in gaps for families who are in the shelter system. And we're still working with the transitional housing at Francis Ward House with Mercy and in her presence, helping with health ed and some just basic screenings and, ask a nurse type of situations. And so we're also looking at collaborating with partners and finding out what they can need help with without duplicating services. And again, we're part of the city of Portland's workforce. So that's our funding right now. So anyways, we are in planning stages of some potential groups in the shelter system or in the community, but we'll keep that posted as we find partners to do that with and find the best way and kind of a needs assessment. So
Excellent. Thank you so much for that update, Marianne. You're doing such great work, and I'm glad that you're still there and here today.
thank you. And we're really excited about what's happened for lactation in general, the funding and Medicaid and doulas and all. So, and it's great to be here to hear the great work everyone's continuing to do.
Yeah. Yeah. Thank you. Awesome. Tamara, I'm sorry, I say your name wrong.
That's okay. It's fine. I've got one of those names.
Same.
Seeing some familiar faces on here. Sarah Tui, I owe you a phone call this afternoon if I can get to it. But I did just want to share some information and updates. And Robbie, you're going to have to pretend that you're not hearing what I'm saying. So I was going to surprise you in a different way. But I co-presented at the PQC for Me conference that was in Freeport a few weeks ago with Kate Crothers from Maine Health and Our Moms and Becca from Mama, which is the app and telehealth maternal mental health program. We were the first agency to do the pilot program. It was hugely successful. Our Moms extended our grant from 6 months to 1 year, and then extended that grant to other WIC agencies that support rural communities and counties. And so Brooke Smith, who is our Maine General WIC director, she has taken on the pilot, and Rochelle Roy, who is our WIC director up in Aroostook County, has taken on that pilot as well. And the numbers for us have been significant. The national average is 24 to 28% test positive with the Edinburgh, and we are at 48 to 52% in our rural communities. And there is a direct correlation to a higher number of mamas who struggle with breastfeeding in the maternal mental health vulnerability. So that's continuing to be a game changer for us and our WIC families. And I think that that there was a lot of interest. I know a lot of you, I'm recognizing names, were at that conference, and so there's a lot of interest in rolling out Mama at the state level. And how does that get funded so that there's no barriers for that? Mama can bill many private insurances, but they are now also credentialed to bill Maine Care. So that was another game changer. And then, as a result of the success of this pilot, I was invited to co-author an abstract with the CEO of Mama, Maureen Fura. And we just got word a couple days ago that that has been accepted at the National WIC Association conference in Minneapolis. So
Awesome.
Maine is leading the way. So I'm excited about that.
That's so great.
And Robbie, when I say this again on Tuesday at the directors meeting, you can pretend that you're just hearing that for the first time.
That's such good news. Can you say in a couple of minutes a little bit more about what the pilot looks like and a little bit more about what Mama does?
Yeah, so Mama is MAMMHA. And it was started by Maureen Fura, who had a horrific postpartum experience. And was told that it would be 6 months before she could get into a mental health care counselor. And she said, I'm going to be dead in less than that. So she worked her way through her journey and then just took this on as a mission for herself. And so it's got kind of four prongs. The first prong is an app that has a lot of resources on that app. Then there is care management. Care managers can help connect to local support resources for that participant. And then there is a telehealth, mental health care counseling that happens one-on-one. And then that fourth prong is really those moms that are at very high risk for psychosis and self-harm, and that's just another whole specialized layer of support for those moms. We have two of those moms, and their mama counselors they are psychiatrists, and they were able to interface pretty seamlessly with their primary care physicians for those moms and get accurate prescriptions and help manage some of that. With respect to how that works within WIC, when a mom comes in, whether they be pregnant or postpartum, we tell them all about the program, that there is no cost to them, and then invite them to screen. We try to get them to screen with us in person. We have a unique link so that I can link into that, and Mama knows that that is a Down East WIC participant when those screenings come through on their end. And then, depending on how they screen, we've had moms that have screened high on that score, and before they've left my office, they are receiving a text message from a care manager that says, it sounds like you might be having a hard time. We've got you. And these are the next steps. In real time, within an hour, I often get an email from Maureen herself or another care manager just saying, we've received this, we've reached out to that mom. We then make a notation in their WIC chart so that we can give them a little bit of extra support and understand that they're working with Mama. And then once a month, I get some analytics from that. It's all HIPAA protected, so there's no, I don't have access to their counseling sessions and that sort of thing, but I can see the level of engagement. And it can be done in the comfort of their homes, which is really important. The barriers that are there in terms of transportation cost, that sort of thing, are not there anymore. So I'm excited for the other two WIC agencies they've started their pilots, I think last month. So Aroostook County and then Brooks Agency out of Maine General. And ideally, it would be great. I know this is a conversation happening within the TEMA landscape. And Kate Crothers would tell you it costs about $15 a mom. Like it's doable. The money's there. And so, but how does that get rolled out across all care providers and access points to those moms is is another topic for discussion. We're not counselors, but we are on the front lines, and we just went through PSI training, the 2-day training, and that was really helpful for my team just to be able to recognize the crisis points and the vulnerabilities so that we can direct them and refer them appropriately and understand where they're coming from and how we can sort of step into those gaps a little bit more.
That's great. What an awesome service. Thank you so much for being a part of piloting that in Maine to show that it's so worth it and to help make it possible for other places to do that. It would be fantastic if it could be statewide. I think we're going to
Yeah.
get there. I can feel it.
Yeah.
A couple of questions that you might see in the chat box. Ashley wants to know if this service is offered to English speakers only or if there are translation services available.
So there are translation services. It's not a wide collection of languages available right now. Spanish, French, I believe there is some Chinese dialects. So, but it is something that is part of their sort of growth rollout is especially if you're going to be working. I mean, Mama is not just for rural. It just happens that our pilot through Our Moms is rural focused. So, but Our Moms is available to anybody. They don't have to go through an agency. A mom can self-screen through the app herself if she needs to or wants to. So that's an important piece of information. Does not have to be funneled through a care provider or an organization. If you're if your sister-in-law is struggling, you can tell her about the Mama app and she can access it herself and do this and self-screen. Yeah. And then we can step into that space a little bit with some language support, but I know it's a big goal to continue to expand that access.
Okay. Kayla has a question related. If you are telling your sister-in-law, for instance, and they're not part of WIC, if they have insurance, can they use it if they have their own insurance to be billed?
They can. So they take they take most private insurances, and I imagine that Maine is not the only state where they're getting credentialed to be able to accept the equivalent of Maine Care services. I know that that was a big push for Maine just because they were rolling out a lot of their pilots through the WIC programs, which are a lot of Maine Care recipients. But also, I want to say that one of Maureen and her team's missions is that no mom gets turned away for inability to pay. So one of the other components to their program is that they have a coalition of counselors. And within that coalition are counselors that need their counseling hours to finish their licensing. There are retired counselors that are choosing to work pro bono. So they just need to say, I don't have private insurance. I don't, and there's a sliding scale, or they will be matched with a counselor who is set up to work within that pro bono space.
Excellent. Thank you so much. This is such a great update. I'm glad you're here.
And you can actually go to YouTube and just Google Maureen Fura, Fura, and Mama, and she's done a lot of like TED Talk type stuff, and she's a really dynamic speaker. So if anybody's interested in doing that, you can find her there as well.
Great. Thank you. Excellent. What other updates or questions are out there? I see Emily Watson is here. I'm going to call you out. Would you mind introducing yourself? I'm really glad to have some hospital representation here. And I'm wondering if you have any questions for anyone here or for us. I know I have an email to respond to you about Zip Milk, and in short, be happy to speak about that. with your group. But do you mind introducing yourself and your connections with everyone?
Yeah, absolutely. My name's Emily Watson. I'm the perinatal outreach coordinator in the southern half of the state. So Maine has two perinatal outreach coordinators, myself and Ann Boomer, who is based out of um, Eastern Maine Medical Center. So she covers the northern half of the state. I cover the southern half of the state. And we are not patient facing. We are hospital clinician facing. So we hope to do all kind of a variety of obstetric and perinatal education and trainings for mostly our inpatient teams. And Mitchell, yes, I will put that in the chat in just a second. And um, we also do work with EDs and EMS services. Since with all of the obstetrical department closures, we're having a lot more obstetric patients present to EDs at non-birthing facilities, and our EMS folks in Maine are having to bear a greater burden for these patients as well. So we do a lot of trainings around that. Um, I do have, many of you may know Paula Norcott. So she works closely with me to kind of execute our lactation kind of part of the pie. So she provides education to anyone who wants it, really within the sphere of like inpatient nurses to public health nurses to anybody that's like providing more community-based lactation support to patients, but may not be CLC or IBCLC trained. So she provides a couple of courses per year called Beyond the Basics of Breastfeeding, which is always really well attended. And as I'm sure you all know, Paula always makes it fun and engaging and does a great job with that. She's also helping to create content for us to share out to all of our hospitals throughout the state. We're finding, as I'm sure is not a surprise, that a lot of our clinical teams are wanting more and more kind of smaller snippets of education that they can take on the go rather than these like 8-10 hour days where they have to go somewhere. And so we're trying to kind of make it a little bit easier to get some of those snippets of education, both to stay up to date, but also to maintain some of the requirements of the job, depending on where they're at. Most places have annual competencies for breastfeeding that they have to meet. And so Paula's been doing a great job of putting together some kind of webinar style educations, and those are not released yet. We're in the process of figuring out a better platform to offer them. I'm trying to figure out if the perinatal outreach program can have a YouTube channel or a Spotify channel. But of course, Maine Health, it's a little bit tricky to do some of those things. I don't make the rules, so I have to ask permission from a whole slew of people. So TBD on that. But I'm hopeful that we can get some more, not public facing, but more easily accessible education to our clinicians on this topic and many, many others. So, so that's kind of my sphere, and that's why I'm here. Kara, I always apologize that I feel like I can never make these meetings. So it's a joy for me when I do get to come and see all of you guys that are doing work directly with patients and families out in the community, because I think that you guys bear so much of the successes and tribulations that we face in the state. And so I appreciate all of the work that you guys are doing to kind of tie the knots and close the loops for these patients and families. And yeah, I think that is it. I'm happy to answer any questions that anybody has about the program or any work that we're specifically doing. I don't think I have any questions specifically to any of you here. I'm just always happy to hear about what's going on around me.
Thanks, Emily. Appreciate that update, and I'm glad that you're able to make it today. I want to read Lindsay and Alyssa's update. Sounds like they had to head out for a meeting. They're from the Maine Health Pediatrics office in South Portland. Alyssa just passed her IBCLC exam. That's great. I don't know, are they? Oh, you are still here. Yay. Congrats, Alyssa. Now there are two IBCLCs on staff between you and Alyssa. That's great, Lindsay. Currently in the process of opening a milk depot and dispensary at your office, so we'll keep everyone posted on the opening date. And if anyone has any advice to share, we'd love to hear it. So I think Robin Snyder Drummond is here on the call too, and she operates a milk depot and dispensary, Robin? Or is it just a depot? Depot in Ellsworth. So I'm sure she'd be happy to hear or happy to chat with you about that. I know you have to pop out, but I was going to ask you, Lindsay and Alyssa, if you have any updates, and maybe this is something we could talk about another time too, but about billing and everything. Is there any questions? I'm not sure if there's anyone here that would be able to help you with that, but if there's anything you wanted to share or ask, you could. And you might not be able to now. You may have had to actually step away. Okay. Who else? Any other questions? Oh, we're at 12:52. We've got a few more minutes. Anything else that folks want to share? Robin, go for it.
Hi, this is just a little teeny bit of good news. I wrote this in a blog. So at the Milk Depot in Ellsworth, we have two donors who donate quite a lot, and we have over 1,500 ounces in a few months. So that's a lot for little babies. But the other cool thing is that one donor works at the Jackson Labs, and they have a nursing mother's room, and she met another mom there, and she told her about the Milk Depot. So that's how we got our second donor. So not only do we have more donors and more milk, but it shows the benefit of lactation-friendly practices in the workplace. So yay on three levels.
I loved reading that blog entry, Robin, on your site, and I'm trying to find it right now. Birth ready? Birth ready. Okay. So people can read it. I'm gonna put that in the chat box. Who else? Sarah, I'm really glad to see you here. Sarah Morris is here. She's our treasurer on our board, and she's amazing, and also had another baby recently. So if your baby happens to be there and you want to put your camera on, we'd all love to see a baby face. But I understand it might not be the right time and place for that either.
Yes. Hi, Kara. Hi, everyone. Yeah, we just had a blowout, so we are not in a position to have cameras on at the moment, but yes, we are here, and thanks for having us.
Awesome. Oh, even the audio is great to hear.
Yeah.
If there's any like Zoom meeting that would be okay with witnessing a blowout too, this is the one.
For sure.
Again, you don't need to turn your camera on though. Awesome. Anyone else? Oh, Deb, you've been monitoring your preteen making lunch. I get that. Here at Bangor Public Health, ready to work with work sites in Penobscot County who would like to establish or improve best practice lactation practices and work toward MSBC recognition. Yes, please. So if you're in that area, please contact Deb. Thanks, Deb, for mentioning that. We've been talking about, I feel like there's been a lot of workplace talk this week, and Abby is here. Abby is going to be is our new chair of our workplace committee. So Abby, I don't know if you want to introduce yourself and maybe put your contact info in the chat too. She'll be facilitating our meetings and sending agendas for anyone who's in that committee. If you're interested in being on that committee, let us know.
I can do a quick intro. So my name is Abby Lacasse. I am a program management specialist. So I work for community health for Penn Bay and Waldo hospitals for Maine Health. And part of my role, I wear multiple hats, but part of my role is working under the Maine Prevention Network Healthy Eating Active Living Grant. So for those of you who don't know, that grant is focused on supporting nutrition, physical activity, and breast chest feeding in our communities, whether it's through policy, system, or environmental support. We typically don't offer direct service, but we're more on the end of, policy and environmental system changes that can make access long-term for our community members for those three pillars of the grant. And so, I recently am taking over this chair position. I'm really excited to be working with with Kara and the team, and we're doing our own policy work here with our local hospital system. So currently we are working on a survey that's getting distributed to our leaders in our two hospital systems to kind of better understand um, the support that might be needed to adhere to our recently adopted Maine Health Lactation policy. And so we felt like before going into the community and asking businesses, if they have a policy, what have they done? What are they currently doing to support? We wanted to do it in our own work and in our own job setting and be sure that our hospital systems are supporting that effort too. So we've learned a lot, and I think it's been really helpful through this process to better prepare me for this role. So I'm really excited. And yeah, if you have any businesses or organizations in your area that think that they would like more support, we are more than happy to help and kind of get the ball rolling for them. So I'll put my contact in the chat.
All right. Thanks, Abby. Sarah, I see your camera's on. Is there a baby there? Also, it's lovely to see your mama face. Oh my gosh. Oh, you're on mute. I don't know if you wanted to be off mute.
Yeah, I'm a mess. But yeah, we're here. We're doing great. And yeah, we just hit the 3-week mark.
Yeah. Oh,
Yeah.
big week, big milestone.
Yeah.
Sending you all the love and warmth and strength and sleep and all of that. And speaking of board members too, I'm going to drop in our board member application for anyone who's interested in joining our board. We accept applications on a rolling basis and are about to kind of put the word out about that opportunity for folks. So thanks for being here today and for sticking it out throughout this whole meeting and participating. It's just been a really fantastic meeting, and I appreciate every single one of you. So thank you all so much. And if you have any other questions or anything you want to share, you know how to contact me or us as a whole. Have a great rest of your day. Enjoy your summer.